All right, I'm going to do my cranial nerve assessment. The first cranial nerve we're going to check is cranial nerve number 1. I'm going to do that by having you, which is the olfactory nerve. I'm going to first have you check your nasal patency by having you occlude one nostril and take a big sniff in, and then do the same thing with the other nostril. And then I'm going to have you shut your eyes, and you're going to take a big whiff of the smell, and I want you to identify it.
Vanilla.
Very good. And then then I have one more smell I want you to take a big whiff of.
Lemon.
Very good, thank you. And then number 2 is the optic nerve. You can open your eyes, and we are going to check your visual acuity with the Rosenbaum chart. I want you to cover one eye and read the furthest line down you can read with your glasses on.
3, 7, 4, 2, 5, 8.
And then go ahead and cover your other eye.
3, 7, 4, 2, 5, 8.
And then go ahead and read the same line with both eyes.
3, 7, 4, 2, 5, 8.
Good. And then also with the optic nerve, we're going to check your visual field with confrontation. So I'm just going to go ahead and wiggle like 2 fingers over here, and you're going to tell me when they're in your field of vision.
See.
And then go ahead and do the same thing.
See.
Good. And then we're going to check cranial nerves number 2 and 3, optic and ocular motor, by checking your pupillary reaction, both for direct and consensual. So I'm going to shine a bright light in your eyes and look for pupillary constriction. Good. Good. Then we're going to check cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. We are checking for extraocular eye movements, so you're going to look straight ahead without moving your head. You're going to just follow my finger with your eyes. We're going to make the pattern of an H, and we're just going to make sure that you can do this without any abnormal eye movements. Very good. And then you're going to follow my finger to your nose, and this is looking for convergence. Very good. And then we're going to check cranial nerve number 5, which is the trigeminal nerve. This is both motor and sensory. The motor aspect has to do with like chewing. So I'm going to have you clench your jaw, and I'm going to feel both your temporal muscle and your masseter muscle, and that should feel equal in strength on both sides, which it does. And then for the sensation portion, you are going to keep your eyes closed for me, and I'm going to touch you in 3 different places on your face, and you're just going to tell me when you feel the touch.
Touch. Touch. Touch.
Very good, thank you. You can open your eyes again. Cranial nerve number 7 is the facial nerve. This has to do with facial sensation. So I'm going to have you just do some facial movements. Raise your eyebrows, clench your eyes shut, smile, show your teeth, and puff out your cheeks. Very good. That should look equal and symmetrical on both sides. Cranial nerve number 8 is the vestibiocochlear nerve, which has to do with hearing, can also affect your balance. We test this by using whispered voice. So I'm going to occlude one ear. I'll whisper 3 letters or numbers. You'll repeat them back to me, and we'll do this for both ears.
X, Y, Z.
Very good.
1, 2, 3.
Very good. Thank you. Then cranial nerves number 9 and 10, glossopharyngeal and vagal, has to do with like your speech and swallowing. So we've been listening to your voice quality. It's not hoarse or nasal at all. And then I'm just going to use my pen light, and we're going to look into your mouth as you say ah, and we're going to look at the movement of your soft palate, your uvula, and your pharynx. And all of that should be equal and symmetrical. Very good. Cranial nerve number 11 is the spinal accessory muscle, which has to do with movement of the trapezius muscles and the sternocleidomastoid muscles. In order to test this, I will use some light resistance and have you shrug your shoulders. And then I will have you turn your head into my hand, and then this way. And it feels equal on both sides. And then cranial nerve number 12 is the hypoglossal nerve, which has to do with your speech also. I'm going to have you say light, tight, dynamite.
Light, tight, dynamite.
Which sounds normal. And then I'm going to just have you open your mouth, and I'm going to look at your tongue. And then have you stick out your tongue and have you move your tongue side to side. And your tongue looks normal. There's no deviations. It's symmetrical on both sides.